Let's begin with the three battles. Notice what you bring into this space. No judgment, just awareness. Episode 3 of peer counseling session, where now we'll be able to at least tackle how you can be your own Shuja, how you can at least unlock that self-infinite possibility. I'm Pius, a hemophilia advocate and a peer counselor, founder of Voices of Shuja, where now in Voices of Shuja, patients use their voice to at least create awareness. Patients use their voice to at least unlock that self-infinite possibility through storytelling and through sharing their lived experience part. So today we explore one of the most challenging difficulties that we face, the battle between what we show and what we carry as shujas. Marcus Aurelius wrote in his private journal about his own struggles, not because he was weak, but because acknowledging our inner reality is the first act of courage. So acknowledge who you are, be your own advocate, and you'll be at least ready enough to at least create change that we as patients need to create. So it's until we come together, it's until we always learn how to like, share, and subscribe, and kindly reach out that unknown blood disorder patient and help me be a person that can even help others unlock that self infinite possibility. So today, how is depression being managed in the community and being managed in the society? Depression isn't a failure of character. Seeking therapy isn't just weakness. And your silent battles, they don't make you broken, they make you human. So let's all be a shujam. And what we cannot control is thus that the onset of depression or anxiety, chemical imbalance in our heads or in our brains, post trauma that shaped our patterns. But in there we can at least start crafting more unique things so that we learn how to self advocate our needs, how others perceive our struggles. You're your own writer of your story. So learn how to at least write your own story. Be a person that can even ignite hope in people's life through you kujikubali. And it all calls for us all at least understanding that you're your own shujam. The timeline of healing is just beginning of how you can at least learn how to be a person that can even ignite hope in others' life. But if you're just there, if you're just quiet, how will you be assisted? What can we control as shujas? It's until we learn how to control our own ways. It's until we learn how to at least be shujas in whatever way that we want to be. So our own decisions to acknowledge what we experiencing is what will lead to us living a more fulfilling life. So, if you want to live a more fulfilling life, if you want to live a more embraced life, how will we acknowledge that? Seeking support whenever or when we need it. That's the way that we want to at least create a more impactful life. The meaning we assign to our experiences, how lived experience can change how we are becoming on a daily perspective. How you can at least acknowledge that you can go through it. You can be a shuja that can even acknowledge that through help, through you being a shuja that can even support each other, we can unlock that self-infinite possibility. Our daily practices and choices determine if we can reach far. So how we speak to ourselves in the darkness, in ourselves inside, matters a lot. So if you speak to yourself in a more positive way, you'll live to a more fulfilling life. But if you're just quiet, if you're just there, how will you even acknowledge that we can live a more fulfilling life? So the mask we wear is what derails us. Share about a time you hid your struggle. What did the mask look like? And what was happening underneath? As for me, back then, I used to feel show stigma because people didn't understand that you can live a more fulfilling life. But me analyzing what I went through made me strong, made me unlock that self-infinite possibility. So be your own Shuja, learn how to at least embrace as life goes by. Learn to at least be a person that can even ignite hope in people's life. Back then, when I was diagnosed, we found out that before moving from home to hospital, it was a big, a big, a big, a big improvement or a big struggle for me. But I learned how to be my own shuja. I learned how to at least advocate for what I want. So let's facilitate things that can even ignite hope in people's life. Let each person speak uninterrupted, and you'll find out that no cross talking or advice giving. That will shape the person that who you becoming. That will shape that person that who you are transforming to be. Simple acknowledgement, thank you for sharing, and or I hear you, shapes that person that who you becoming in the support system. So help that person ignite hope in other people's life. Help that person be a shuja that can even reflect that it's easy through guiding them to perceive their own perceptions well. Epictetus taught that we even we usually suffer from events, but from our judgment about them. Sometimes the heaviest judgment is the one we place on our own pain, that it shouldn't exist, that we should be stronger, that our struggles invalidates us. What if we remove that judgment? What if we remove that judgment? Depression often whispers, "You are alone in this." Therapy asks, "What if you are not? What has silence cost you? And what did breaking it offer you?" The difference between solitude and isolation. You'll find out that if you are solitude in whatever that you do in a stoic virtue, you'll be able to at least unlock that self-infinite possibility. But if you are isolated, you will suffer. You will suffer from your own passiveness. You'll suffer from your own ways. So what made me reach out that treatment center is what built me today. I can say back then, I used to say that it's not easy, but it's until I embrace whatever that I went through. It's until I learned how to at least live a more fulfilling life. That's when now everything changed. That's when now I became my own shuja. That's when now everything changed as per what I wanted. But let's all become shujas in whatever way that we want. Let's all advocate for what we want to see. It's until we become our own shujas. It's until we learn how to come together as shujas, learn how to self-advocate. That's when now everything will come unto whatever that we want. Seneca wrote letters to a friend struggling with despair, not to fix him, but to remind him he wasn't alone. Your present here is that act for yourself and for each other. Let's all come together. Let's all learn how to be a person that can even ignite hope in people's life. Let's all come together. Let's all ignite through like, share, and subscribe so that we reach out that unknown person living with a blood disorder. Healing isn't just a straight line. Share about a setback or even a relapse or a moment you felt you lost your progress. Me back then, I used to play rugby, but right now I hung boots because of what I learned how to embrace who I am. I learned how to go through that healing process to become who I am. Marcus Aurelius wrote, "Walk each day and how to choose that." His philosophy again, recovery is the same days you choose it clearly, some days you barely choose it at all. Both days count. So if you choose not to and if you choose to, the perspective here is just progress as spiral, not ladder. The courage in beginning again. You'll be able to at least step into another version of you. You'll be able to at least step into a more inclusive community that if you want to create. Amorphati, not toxic positivity, but radical acceptance of what it is. Accept that you're living with sickle cell, accept that you're living with hemophilia, accept that you're living with blood-related disorders. Hemophilia is a rare genetic blood disorder where we lack clotting factors. It's basically two types. Hemophilia A, where we lack factor 8, and hemophilia B, where we lack factor 9. Mine is hemophilia B, and I manage it and I live a more fulfilling life because I embrace every part that life tells me. And if I can be a Shuja that can even ignite hope in people's life, why should I not use my life? Why should I not use my voice? Go to the voices of Shuja, learn how patients are using their voices enough to at least create change on how they became bold enough to live with sickle cell, to live with hemophilia, to live with von Willebrand disease. Remember, women bleed too, the von Willebrand disease. And today might be hard. I might feel the weight return. If it does, this is what I'll do. Have that support system that you know you can count on. People have friends, people have those that want to support them, that you let them be. And what did I do right or wrong? But did I show up today in whatever capacity I could? The people that are surrounding me, are they helping me to be a Shuja? Are they igniting hope in people's, or are they even there to at least support who you're becoming every day? So, common depression lies that people tell, and these ways taught me to be a person that can even ignite hope in people's life. So, in a stoic response, depression says that you're a burden, but in a stoic truth, asking for help is courage. Leading others is human. You have to at least remove yourself from a victim-minded set. Create a more impactful environment through you accepting that you can write your own perspective. You can write your own story. Remember, you're the one holding the pen to write your story. You're the one igniting hope in people's life. But if you're burdened, how will you even ignite hope in people's life? If you're just weak and you tell yourself that you can't do it, how will you even ignite hope in people's life? If you can't support your own argument, if you can't support who you're becoming every day, how will we create a more impactful environment? So you are weak for struggling. That's a depression. But the struggle is itself proves you your strength to continue. So let's all continue advocating. Let's all come together. Let's all reach out that unknown blood disorder patient, stay Shuja, and you'll be able to unlock that self-infinite possibility in whatever accord that we want. Nothing will change. I used to tell myself that ati hakuna kitu itachange kwa maisha yangu, but I learned how to embrace life. I learned how to be my own Shuja. I learned how to at least say that I'm my own writer. I'm my own accord. I'm my own Shuja. So you cannot know the future. Stay present to this moment. Say that you can hold the pen, you can write that story that you want to write. But if you're afraid of acknowledging that who you are every day, if you're afraid of living a more fulfilling life, how are we creating that person that who you want to be? Remember, you are a person that can even ignite hope in your own accord. You should be over this by now in a way that healing has no time. Accept what it is now. If you accept whatever that you are going through, living with the hemophilia, living with the sickle cell, you'll be able to at least say that I'm the one igniting hope in my own accord. I'm the one writing what I'm going through. But if I accept that I can unlock that self-infinite possibility around me, and I can at least reach out to the people that I can say they can ignite hope, how will you even at least come together as Shujas, at least raise awareness in whatever way is possible? How will you even say that we can come together, we can at least say that we will unlock that self-infinite possibility. We will live a more fulfilling life. But it all calls for us acknowledging that we will reach more borders. We will be a person that can come together as a community and raise awareness. Everyone else has it together, but you see their minds, their masks, not their battles. Release comparisons. Don't compare yourself with other people's. Be your own Shuja and learn that you're your own writer. Learn that in everything that you do as a Shuja, you'd be able to at least ignite people's life. You'll be able to at least ignite other people's life. The Stoic had mentors, spiritual directors who helped them examine their thinking. Therapy is this tradition involved. It's not weakness to need a guide from the liberace of your mind. It's just that you have to accept, you have to be a shuja. And what does therapy offer? External perspective when you're too close to see clearly. When you have your own support system, or when you go to the healthcare providers, you'll be able to be assisted in whatever way that you want. Skills for the dichotomy, practical tools for what you can control, how you perceive things, how you perceive your own thoughts. They're the way that you'll hold the pen to write it. And if you perceive your thoughts in a way that you accept it well, you'll be able to at least actionate what you want to see in the community. So, witness to pain. Someone who sits with you in the darkness is that person that can at least help you come out of that darkness. And you'll have to at least have a support system like your family, your friends, and who who you're becoming every day. So if you have a family that can even ignite hope in your own accord, let's say that help them, they help you ignite that self-infinite possibility. How to Shuja here can at least say that I use my voice as a Shuja to at least raise awareness. I use social stigma, I use social isolation to create a more impactful life. Pattern interruption like breaking cycles that can break you alone. You find out that I use my voice as being a person that can even ignite people's life. What myths about therapy have you believed that? What truths have you discovered? Therapy means you are broken. Therapy means you are brave enough to look for change. If you can say that your mental health deserves that space to at least create a more impactful environment, create it. Create your own space to just learn to at least listen to yourself. Learn to at least disconnect people that are not helping you at all. Create people that will even bring you from here to here. But if you have people that cannot even ignite hope in your life, where are we going? You should fix yourself alone. No. The stories had communities. We need others. Create people that in your environment that, as I said, can elevate you from low to a big environment. Therapy is just complaining. No, therapy is structured to work toward change. So if you start with small habits comes that me before nilale, no matter that I'll have to read something. Before I wake up or after I wake up, I have to drink some water. I have to at least start planning my day on whatever that way that day goes through. Nikipatana mtu anaweza discourage, I just don't give that person my time because it will derail my plan for the day. So if you have to be focused on what you want to accomplish in that day, time heals all wounds. Time plus intentional work heals wounds. But if you want to build a more infinite possibility, discipline of perception, your thoughts, you have to at least build a more inclusive environment. Practice when a negative thought arises. Pause, ask, is this true? Is it helpful? Is this mine or is this depression talking? Thought record journal. CBT meets stoicism. Discipline of action, your choices. You find out that one small act of virtue per day, even on hard days. Make your bed, text a friend, take medication, feed yourself, take care of who you becoming. What would I advise my best friend to do right now? I challenge you. What can you advise your friend to do right now? And discipline of will, your acceptance. This is a hard day. Accept that this is where I am. This doesn't define tomorrow. Amor fati meditation. Can you make peace with this moment as it is? How are you accepting who you are? How are you becoming your own shuja or advocate? This week, I commit to one thing I can control, one support I will access, one stoic practice I will try, and one person I'll be honest with. Complete this sentence. One thing I'm taking from today is Seneca wrote, sometimes even life is an act of courage. If you've made it today, through depression, through silence, through battle, through already demonstrated profound courage. You're not your depression. You're not your worst days. You are someone courageous enough to sit in this cycle and say, I struggle and I'm still here. The Stoics believed that in the inner citadel, a fortress inside you that cannot be breached by external circumstances. But here is what they sometimes missed. You don't have to defend that citadel alone. We are here. Therapy is here. Support is here. Your silent battle doesn't have to stay silent. And in speaking, you diminish its power. Place your hand on your heart. Feel it beating. That's proof you're here. You survived 100% of your hardest days. So far, you're enough exactly what you want to be. Let's all stay shuja, like, share, and subscribe so that we reach out to that unknown blood disorder patient. See you on the next live session of the peer counseling episode. Stay shuja.